This is the opensource.club, a free St. Louis-focused knowledge share podcast. Through industry experts, entrepreneurs, personal stories, and more, we provide the information you need to achieve and thrive. Always visit our website, theopensource.club, for more details. Contact us on Facebook, Twitter, or LinkedIn.
More than half of the women in the United States are in their childbearing years. Many do not want an unplanned pregnancy. A July 2020 ruling by the U.S. Supreme Court exempted businesses, universities, and moral objectors from providing birth control with insurance coverage. Women's ability to use contraception to prevent unplanned pregnancies is associated with broad health, social, and economic benefits. According to the National Institutes of Health, unplanned births are associated with relationship conflicts, depression, and limited education. I'm your host, Ruth Ezel, and this is Healthy You by the Open Source. This episode is sponsored by Planned Parenthood, a trusted healthcare provider and educator.
You're listening to Healthy You by the Open Source. Become a subscriber and hear all our shows. Go to www.theopensource.club and insert your email address in the podcast subscription window.
My guest today on Healthy You is nurse practitioner Donna White at Planned Parenthood. White has an extensive nursing career that spans 26 years. She's worked in private practice, public health, and for community agencies. Welcome, Donna.
Thank you. I'm excited to be here.
Oh, it's going to be an exciting conversation. Now, for a significant number of women, birth control is an economics issue. Women are typically caregivers, so they lose a lot of ground by coming in and out of the job market. Has birth control tightened the wage gap?
Oh, yes, it has. Women having access to birth control at a young age affects how much money they can make in their 30s and 40s. Birth control allows the woman to delay having a child, which means that she can, invest in her higher education, her career. And by not having to go in and out of the market, that gives them more of a chance for advancement and higher pay.
Now, a lot of women, they just can't afford birth control. Private researchers are saying the number is as high as 20 million women. Is that what you found, and are there solutions?
It is true, and now that companies can opt out of covering birth control for their employees, that number could go up. Most women rely on their insurance coverage through their employers to cover the cost of their birth control. The only solution at this time would be a family planning clinic that receives federal funding and other grants.
So what birth control options are available in 2020, and what are the benefits of each one?
Oh, there's so many. I can start with the most effective methods. Sterilization, which would be vasectomy for men, tubal ligation for women, and of course that would be permanent and no hormones involved. Another method would be the Nexplanon, which is the implant that goes into the upper arm, and it's like 99% effective, and it's good for 5 years. And most women will find that they have lighter or no periods. There's also the Hormonal Iud. There's like 3 different ones, three different brands of that type, and they're effective anywhere from 3 to 7 years. Then there's a non-hormonal IUD called the Paragard, and that contains no hormones. That's good for 12 years. And most women like that because they don't want hormonal side effects. There is Depo Provera, which is a shot they get every 3 months. It's 99% effective, and the benefit to that would be lighter or no periods.
Oh, you mean the standard birth control pill?
Yeah, the standard birth control pill. And, of course, you take a pill every single day, and the benefit to that would be regulated periods and some help with acne.
Okay. Now, your career has spanned over a quarter of a century, and I'm wondering if over the course of that time, have you seen preferences shift from one type of birth control method to the other, just among the general populace of women that you've seen?
Oh, yes. back when I first started, 26 years ago, the IUD was mainly for women who had already had children. I have adolescents coming in and getting IUDs now for birth control.
Interesting. I would not have thought that.
Yes, and since we started doing telehealth, I've been doing more like vasectomy counseling, before they have their surgery, the men have their surgery, and I've noticed younger men, like in their 20s, getting vasectomies.
Very, very interesting.
It is.
It's interesting that you mention men because I don't think a lot of men know that service is available at Planned Parenthood.
Oh, yeah, we see men for that service, birth control. We see them for STI testing, lots of things.
Wow. Last year, Planned Parenthood serviced thousands of patients. The demand is obviously there. So what are your locations?
We operate like 8 locations, and all the locations do provide birth control. There's Central West End, South Grand, North County, West County, St. Peters, Springfield, Missouri, Joplin, Missouri, and Fairview Heights, Illinois. Oh, and then, of course, the telehealth, we can reach patients all across the state, and no appointment is needed. No need to go to a health center if you do it that way.
Mm-hmm. So there are a lot of options. So who exactly is eligible for services?
We provide wellness for everyone. Like I said earlier, men, women, adolescents. We see patients who do have insurance, and we see patients who do not have insurance.
Now, Planned Parenthood is taking part in what's known as the Right Time Initiative. What's that, and who qualifies for that?
Oh, yes, we're excited about that. The Right Time Initiative is like a 6-year grant that allows us to provide quality contraception services at no charge. So the birth control visit is free, the birth control is free, and it's for women who have no insurance or women who are underinsured.
Why did this get created in the first place, do you know?
Well, it's funded by Missouri Foundation for Health, and it was created to reduce the Missouri unintended pregnancy rate by like 10%. That's the goal.
Wow. What part of the states is taking most advantage of it? Or is it pretty much statewide in terms of interest?
Well, there are certain clinics. It is statewide. We have 4 locations that are participating in the grant: Central West End, South Grand, Springfield, Missouri, and Joplin, Missouri.
And where can people get more information about that particular program?
They can call any of our health centers. Phone number is 314-531-7526. They can go online. It's an excellent program, and it's all over the Internet.
So, and you use that same number if you want to get an appointment, I take it?
Yes.
I'm kind of curious and I always ask this, no matter who I'm interviewing, their motivation for doing what they do. What do you get out of it? And why did you decide to become a nurse practitioner?
That's a good question. I was working for a plastic surgeon as a receptionist, and the doctor said, and then I went from receptionist to helping him, assisting him in surgery, and he goes, I'm not going to be here forever. You need to go back to school. And so I went back to school, got my RN degree, went back more, became a nurse practitioner. I like helping people. I know all nurses say I like helping people, but I feel rewarded whenever I have a patient that comes back year after year, and I see this, you get to know them, and they said they've been coming to Planned Parenthood since they were a teenager and wouldn't want to go anywhere else. It's rewarding.
Well, I must say that doctor gave you some great advice.
He did.
Wonderful. Donna White, nurse practitioner at Planned Parenthood. Thank you so much for joining us and for giving us all this valuable information.
Thank you for having me. This is exciting. This is my first podcast.
Well, you just sailed through it. Congratulations.
Well,
Take care.
Thank you.
Birth control is a critically important component of women's health, whether employers cover it in health plans or not. Planned Parenthood offers free or low-cost options. There are 8 physical locations in Missouri. For more information, go to PlannedParenthood.org. My thanks to Donna White for being a guest on Healthy You by The Open Source. I'm your host, Ruthie Zell.
Thank you for listening to the opensource.club podcast. Become a subscriber through RSS or YouTube. There's more to come that you won't want to miss. Our name is our web address, theopensource.club.